1. What is the normal duration of the PR interval in an ECG? A. 0.04 to 0.08 seconds. B. 0.12 to 0.20 seconds. C. 0.22 to 0.26 seconds. D. 0.30 to 0.36 seconds. Answer: B. 0.12 to 0.20 seconds. Rationale: the normal duration of the PR interval is 0.12 to 0.20 seconds. This interval reflects the time taken for the electrical impulse to travel from the atria to the ventricles. Options A, C, and D are outside the normal range. 2. Which arrhythmia is characterized by an absent P wave and an irregular rhythm? A. Atrial fibrillation. B. Ventricular tachycardia. C. Sinus bradycardia. D. Atrioventricular block. Answer: A. Atrial fibrillation. Rationale: atrial fibrillation is characterized by an absent P wave and an irregular rhythm. This is due to rapid and erratic electrical activity in the atria. The other options show different characteristics. Ventricular tachycardia has wide QRS complexes, and AV block shows prolonged PR intervals. 3. What does a prolonged QT interval increase the risk of? A. Atrial fibrillation. B. Torsades de pointes. C. Myocardial infarction. D. Sinus arrhythmia. Answer: B. Torsades de pointes. Rationale: a prolonged QT interval increases the risk of torsades de pointes, a type of life-threatening arrhythmia. It is often associated with electrolyte imbalances, medications, or congenital conditions. Options A, C, and D are unrelated to prolonged QT interval. 4. Which ECG finding is commonly associated with a myocardial infarction? A. ST segment elevation. B. T-wave inversion. C. Shortened PR interval. D. Prolonged QRS duration. Answer: A. ST segment elevation. Rationale: ST segment elevation is a hallmark of acute myocardial infarction, MI. This reflects injury to the heart muscle. T-wave inversion can occur post-MI, but is not as immediately indicative as ST elevation. Other options are not typically linked to MI. 5. In which condition would you expect to see a sawtooth pattern in the ECG? A. Atrial fibrillation. B. Atrial flutter. C. Ventricular tachycardia. D. Normal sinus rhythm. Answer: B. Atrial flutter. Rationale: the sawtooth pattern, also known as flutter waves, is characteristic of atrial flutter. It occurs due to rapid atrial contractions. In atrial fibrillation, the rhythm is irregular, without distinct P waves. Ventricular tachycardia has wide QRS complexes, and normal sinus rhythm does not have this pattern. 6. What is the first step in managing a patient with symptomatic bradycardia? A. Administer atropine. B. Perform defibrillation. C. Increase fluids. D. Perform cardioversion. Answer: A. Administer atropine. Rationale: the first step in managing symptomatic bradycardia is to administer atropine, which can increase the heart rate. Defibrillation is used for arrhythmias like ventricular fibrillation, not bradycardia. Fluids and cardioversion are not immediate treatments for symptomatic bradycardia. 7. Which rhythm is characterized by wide QRS complexes greater than 0.12 seconds? A. Normal sinus rhythm. B. Atrial fibrillation. C. Ventricular tachycardia. D. First-degree AV block. Answer: C. Ventricular tachycardia. Rationale: ventricular tachycardia is characterized by wide QRS complexes greater than 0.12 seconds, indicating abnormal conduction originating from the ventricles. Atrial fibrillation has no distinct QRS morphology, and first-degree AV block has a prolonged PR interval, not wide QRS complexes. 8. Which electrolyte imbalance can lead to a prolonged QT interval? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer: B. Hypokalemia. Rationale: hypokalemia can lead to a prolonged QT interval, increasing the risk of torsades de pointes. Hyperkalemia is more commonly associated with peaked T waves and a shortened QT interval. Hypercalcemia can shorten the QT interval, while hypomagnesemia may also contribute to arrhythmias, but less directly to a prolonged QT interval. 9. What does a P wave that is not followed by a QRS complex most likely indicate? A. Premature atrial contraction. B. Atrial fibrillation. C. Atrioventricular AV block. D. Ventricular tachycardia. Answer: C. Atrioventricular AV block. Rationale: a P wave not followed by a QRS complex indicates a type of AV block where the impulse from the atria does not reach the ventricles. This is common in second or third-degree AV block. Premature atrial contractions are usually followed by a normal QRS complex, and atrial fibrillation has an irregular rhythm with no P waves. 10. Which arrhythmia is characterized by a regularly irregular rhythm? A. Atrial fibrillation. B. Sinus arrhythmia. C. Supraventricular tachycardia. D. Junctional rhythm. Answer: B. Sinus arrhythmia. Rationale: sinus arrhythmia is characterized by a regularly irregular rhythm, typically related to respiratory variations. Atrial fibrillation has an irregularly irregular rhythm, and supraventricular tachycardia has a regular, fast rhythm. Junctional rhythm often has an absent or inverted P wave, but a regular rhythm. 11. What is the primary treatment for a patient in ventricular fibrillation VF? A. Administer atropine. B. Perform defibrillation. C. Administer adenosine. D. Provide supplemental oxygen. Answer: B. Perform defibrillation. Rationale: the primary treatment for ventricular fibrillation is defibrillation, which aims to reset the heart's electrical activity. Atropine is used for bradycardia, adenosine for supraventricular arrhythmias, and oxygen is supportive, but not the definitive treatment for VF. 12. Which of the following is characteristic of a second-degree type I, Wenckebach, AV block? A. Progressive prolongation of the PR interval until a QRS is dropped. B. A fixed PR interval with dropped QRS. C. No P waves observed. D. Complete block of the AV conduction. Answer: A. Progressive prolongation of the PR interval until a QRS is dropped. Rationale: second-degree type I, Wenckebach, AV block is characterized by progressively prolonged PR intervals until a QRS complex is dropped. This differs from second-degree type 2, which has a fixed PR interval and intermittent dropped QRS complexes. Complete AV block has no conduction to the ventricles. 13. What is the normal range for the heart rate in sinus rhythm? A. 40 to 60 BPM. B. 60 to 100 BPM. C. 100 to 120 BPM. D. 120 to 150 BPM. Answer: B. 60 to 100 BPM. Rationale: in normal sinus rhythm, the heart rate typically ranges from 60 to 100 BPM. A heart rate below 60 BPM is bradycardia, while above 100 BPM is tachycardia. 14. A broad and notched P wave on an ECG suggests which condition? A. Right atrial enlargement. B. Left atrial enlargement. C. Atrial fibrillation. D. Atrial flutter. Answer: B. Left atrial enlargement. Rationale: a broad and notched P wave is indicative of left atrial enlargement, often seen in conditions such as mitral valve disease. Right atrial enlargement leads to a tall, peaked P wave. Atrial fibrillation and flutter have irregular P wave morphology, or no distinct P waves at all. 15. What does a delta wave on the ECG indicate? A. Atrial fibrillation. B. Wolff-Parkinson-White syndrome. C. Sinus arrhythmia. D. Myocardial infarction. Answer: B. Wolff-Parkinson-White syndrome. Rationale: a delta wave is characteristic of Wolff-Parkinson-White syndrome, where there is an accessory pathway between the atria and ventricles, leading to pre-excitation. It is not seen in atrial fibrillation, sinus arrhythmia, or myocardial infarction. 16. Which of the following is a feature of the T wave on an ECG? A. It represents ventricular depolarization. B. It is always upright in all leads. C. It represents ventricular repolarization. D. It is a part of the PQRST complex. Answer. C. It represents ventricular repolarization. Rationale. The T wave represents ventricular repolarization. It can be either upright or inverted depending on the lead and condition. It is not associated with depolarization or the PQRST complex, but is a part of the overall ECG complex. 17. In which condition would you expect to see a Q wave in the ECG? A. Normal sinus rhythm. B. Myocardial infarction. C. Atrial fibrillation. D. Left bundle branch block. Answer. B. Myocardial infarction. Rationale. A Q wave in the ECG is often associated with myocardial infarction, especially in the inferior leads, indicating myocardial necrosis. In normal sinus rhythm, a Q wave is typically small or absent. The other conditions do not necessarily result in Q waves. 18. A wide QRS complex greater than 0.12 seconds with a rapid heart rate is most likely to indicate A. Sinus tachycardia. B. Atrial fibrillation. C. Ventricular tachycardia. D. Normal sinus rhythm. Answer. C. Ventricular tachycardia. Rationale. A wide QRS complex greater than 0.12 seconds with a rapid heart rate is most characteristic of ventricular tachycardia, a potentially life-threatening arrhythmia. Sinus tachycardia, atrial fibrillation, and normal sinus rhythm do not exhibit wide QRS complexes with rapid rates. 19. Which medication is most likely to cause a prolonged QT interval? A. Digoxin. B. Lithium. C. Amiodaron. D. Furosemide. Answer. C. Amiodaron. Rationale. Amiodaron, an antiarrhythmic medication, is known to cause a prolonged QT interval. Digoxin can cause arrhythmias, but does not typically prolong the QT interval. Lithium and furosemide are less commonly associated with QT prolongation. 20. What is the treatment of choice for a patient in symptomatic bradycardia? A. Defibrillation. B. Atropine. C. Synchronized cardioversion. D. Amiodaron. Answer. B. Atropine. Rationale. Atropine is the treatment of choice for symptomatic bradycardia as it works by increasing the heart rate through vagal inhibition. Defibrillation is used for ventricular arrhythmias, not bradycardia. Synchronized cardioversion and amiodaron are used for other arrhythmias. 21. What does a QRS complex represent in an ECG? A. Atrial depolarization. B. Ventricular depolarization. C. Ventricular repolarization. D. Atrial repolarization. Answer. B. Ventricular depolarization. Rationale. The QRS complex represents ventricular depolarization, which is when the ventricles are activated to contract. Atrial depolarization is represented by the P wave, and repolarization of the ventricles is shown by the T wave. 22. In which rhythm would you see a heart rate of 150 to 250 BPM with a narrow QRS complex? A. Atrial fibrillation. B. Ventricular tachycardia. C. Supraventricular tachycardia. D. Sinus tachycardia. Answer. C. Supraventricular tachycardia. Rationale. Supraventricular tachycardia, SVT, is characterized by a rapid heart rate, 150 to 250 BPM, and narrow QRS complexes. Atrial fibrillation has an irregular rhythm, and ventricular tachycardia has wide QRS complexes. Sinus tachycardia is slower and has normal QRS complexes. 23. Which of the following ECG findings is most indicative of hyperkalemia? A. Peaked T waves. B. Prolonged PR interval. C. QRS complex narrowing. D. Inverted T waves. Answer. A. Peaked T waves. Rationale. Hyperkalemia typically causes peaked T waves due to the effect of high potassium levels on repolarization. A prolonged PR interval, QRS complex narrowing, and inverted T waves are more commonly associated with other conditions. 24. Which of the following is a common feature of third-degree AV block? A. Complete dissociation between atrial and ventricular activity. B. Prolonged PR interval. C. Sinus arrhythmia. D. Narrow QRS complexes. Answer: A. Complete dissociation between atrial and ventricular activity. Rationale: in third-degree AV block, also called complete heart block, there is complete dissociation between atrial and ventricular activity, meaning the atria and ventricles beat independently. This results in a regular atrial rhythm but a slower, independent ventricular rhythm. 25. What does a U wave on an ECG typically indicate? A. Atrial depolarization. B. Early ventricular repolarization. C. Late ventricular repolarization. D. The onset of a myocardial infarction. Answer: B. Early ventricular repolarization. Rationale: a U wave is often seen as a small deflection after the T wave and is thought to represent early repolarization of the ventricles. It is more pronounced in cases of hypokalemia or bradycardia. 26. What does an inverted T wave on an ECG generally indicate? A. Myocardial ischemia. B. Electrolyte imbalance. C. Atrial fibrillation. D. Sinus rhythm. Answer: A. Myocardial ischemia. Rationale: an inverted T wave is commonly seen in myocardial ischemia, where there is inadequate blood flow to the heart muscle. Electrolyte imbalances, atrial fibrillation, and normal sinus rhythm do not typically cause inverted T waves. 27. Which of the following medications is most likely to cause a prolonged PR interval? A. Amiodarone. B. Digoxin. C. Calcium channel blockers. D. Beta blockers. Answer: B. Digoxin. Rationale: digoxin is known to cause a prolonged PR interval by slowing conduction through the AV node. Amiodarone and calcium channel blockers may affect other aspects of the ECG, while beta blockers generally have a mild effect on the PR interval. 28. In which condition would you expect to see a wide QRS complex with a heart rate greater than 100 BPM? A. Normal sinus rhythm. B. Atrial fibrillation. C. Ventricular tachycardia. D. Sinus tachycardia. Answer: C. Ventricular tachycardia. Rationale: ventricular tachycardia typically presents with a wide QRS complex greater than 0.12 seconds and a heart rate greater than 100 BPM. The other options generally present with a normal QRS complex or an irregular rhythm without such a wide QRS. 29. A patient has a heart rate of 40 BPM, a prolonged PR interval, and a dropped QRS complex. What type of block is this? A. First-degree AV block. B. Second-degree AV block type I. C. Second-degree AV block type 2. D. Third-degree AV block. Answer: B. Second-degree AV block type I. Rationale: second-degree AV block type I, Wenckebach, is characterized by progressively prolonged PR intervals until a QRS complex is dropped. This differs from other types of AV block, where there is a consistent PR interval or complete block of conduction. 30. Which of the following is a characteristic of a PVC, premature ventricular contraction? A. Narrow QRS complex. B. Early ventricular depolarization. C. Followed by a compensatory pause. D. Normal P wave. Answer: C. Followed by a compensatory pause. Rationale: PVCs are characterized by early ventricular depolarization and are often followed by a compensatory pause, which makes the rhythm irregular. They are associated with wide QRS complexes. A narrow QRS complex and normal P wave are not characteristic of PVCs. 31. Which ECG finding is most commonly associated with hypercalcemia? A. Shortened QT interval. B. Prolonged QT interval. C. Peak T waves. D. First-degree AV block. Answer: A. Shortened QT interval. Rationale: hypercalcemia commonly leads to a shortened QT interval due to the effect of high calcium levels on ventricular repolarization. Other ECG findings, such as prolonged QT interval or peaked T waves, are more commonly seen with electrolyte imbalances like hypokalemia or hyperkalemia. 32. What does a bizarre QRS complex in a regular rhythm suggest? A. Ventricular tachycardia. B. Atrial fibrillation. C. Sinus rhythm. D. First-degree AV block. Answer. A. Ventricular tachycardia. Rationale. A bizarre QRS complex is often seen in ventricular tachycardia, where the electrical impulses are originating from the ventricles and cause abnormal conduction. Atrial fibrillation and sinus rhythm have distinct P waves and more normal QRS complexes. First-degree AV block has a prolonged PR interval. 33. What does the P wave on an ECG represent? A. Ventricular depolarization. B. Atrial repolarization. C. Atrial depolarization. D. Ventricular repolarization. Answer. C. Atrial depolarization. Rationale. The P wave represents atrial depolarization, which is the electrical impulse spreading through the atria before contraction. It does not represent ventricular depolarization, QRS complex, or repolarization, T wave. 34. What does an ST segment elevation in leads V2 to V4 indicate? A. Myocardial infarction. B. Atrial fibrillation. C. Hyperkalemia. D. Left bundle branch block. Answer. A. Myocardial infarction. Rationale. ST segment elevation in leads V2 to V4 is characteristic of a STEMI ST segment elevation myocardial infarction, particularly affecting the anterior wall of the left ventricle. Other conditions like atrial fibrillation and hyperkalemia do not cause specific ST segment elevations. 35. What is the most common cause of a left axis deviation on an ECG? A. Left ventricular hypertrophy. B. Myocardial infarction. C. Pulmonary embolism. D. Right ventricular hypertrophy. Answer. A. Left ventricular hypertrophy. Rationale. Left axis deviation is most commonly associated with left ventricular hypertrophy, where the heart's electrical axis shifts due to the increased mass and workload of the left ventricle. Other causes like myocardial infarction or pulmonary embolism have different ECG findings. 36. Which of the following rhythms would most likely present with no P wave and a rapid, irregular rhythm? A. Atrial fibrillation. B. Atrial flutter. C. Sinus tachycardia. D. Supraventricular tachycardia. Answer. A. Atrial fibrillation. Rationale. Atrial fibrillation is characterized by the absence of distinct P waves and a rapid, irregularly irregular rhythm. Atrial flutter typically has a sawtooth pattern of P waves, while the other options have regular rhythms with clear P waves. 37. Which type of rhythm is most associated with a sawtooth pattern of P waves? A. Atrial fibrillation. B. Atrial flutter. C. Sinus rhythm. D. Ventricular tachycardia. Answer. B. Atrial flutter. Rationale. Atrial flutter is characterized by a sawtooth pattern of P waves due to rapid atrial contractions. Atrial fibrillation has no distinct P waves, and sinus rhythm has normal, consistent P waves. Ventricular tachycardia has wide QRS complexes and no P waves. 38. Which ECG finding is characteristic of hypothermia? A. Osborn waves. B. Peaked T waves. C. Flattened P waves. D. Shortened QT interval. Answer. A. Osborn waves. Rationale. Osborn waves, or J waves, are characteristic of hypothermia and appear as small upward deflections at the junction of the QRS complex and ST segment. Other conditions like hyperkalemia or electrolyte imbalances lead to different findings. 39. Which of the following ECG findings is most likely to be seen in a patient with digoxin toxicity? A. Prolonged PR interval. B. Shortened QT interval. C. Wide QRS complexes. D. Flattened T waves. Answer. A. Prolonged PR interval. Rationale. Digoxin toxicity often results in a prolonged PR interval and can also cause other changes like increased automaticity, but the PR interval is the most prominent. It does not typically shorten the QT interval or cause wide QRS complexes. 40. In an ECG, What would an absent P wave and an irregularly irregular rhythm indicate? A. Atrial fibrillation. B. Sinus tachycardia. C. Ventricular fibrillation. D. Supraventricular tachycardia. Answer: A. Atrial fibrillation. Rationale: atrial fibrillation is characterized by the absence of distinct P waves and an irregularly irregular rhythm. Sinus tachycardia, ventricular fibrillation, and supraventricular tachycardia have different ECG features. 41. Which of the following would be the most common ECG finding in atrial fibrillation? A. Regular RR intervals. B. No distinct P waves. C. Sawtooth pattern of P waves. D. Prolonged PR interval. Answer: B. No distinct P waves. Rationale: in atrial fibrillation, there is no distinct P wave, and the rhythm is irregularly irregular. Other rhythms like atrial flutter or sinus arrhythmia have distinct P waves or regular intervals. 42. What does the ST segment depression on an ECG suggest? A. Myocardial ischemia. B. Myocardial infarction. C. Hyperkalemia. D. Pericarditis. Answer: A. Myocardial ischemia. Rationale: ST segment depression is often a sign of myocardial ischemia, indicating reduced blood flow to the heart. It is not a definitive sign of a myocardial infarction, which would show ST segment elevation. 43. What is a Q wave on an ECG most commonly associated with? A. Early ventricular depolarization. B. Myocardial infarction. C. Atrial depolarization. D. Right bundle branch block. Answer: B. Myocardial infarction. Rationale: a Q wave is a sign of a previous myocardial infarction and is seen in the ECG as a deep or wide negative deflection in the QRS complex. Early ventricular depolarization is represented by the QRS complex, not specifically a Q wave. 44. What does a prolonged QT interval on an ECG indicate? A. Hyperkalemia. B. Risk for ventricular arrhythmias. C. Acute myocardial infarction. D. Hypotension. Answer: B. Risk for ventricular arrhythmias. Rationale: a prolonged QT interval can increase the risk of dangerous arrhythmias like torsades de pointes. It is not typically associated with hyperkalemia, myocardial infarction, or hypotension. 45. In an ECG, what does a wide QRS complex usually indicate? A. Atrial fibrillation. B. Ventricular tachycardia. C. Hyperkalemia. D. Second-degree AV block. Answer: B. Ventricular tachycardia. Rationale: a wide QRS complex is most commonly seen in ventricular tachycardia, where abnormal ventricular electrical activity occurs. Other conditions like atrial fibrillation and AV blocks typically have narrow QRS complexes. 46. Which of the following ECG findings is most associated with hypokalemia? A. Peaked T waves. B. U waves. C. Shortened QT interval. D. T wave inversion. Answer: B. U waves. Rationale: hypokalemia often causes U waves, which are small deflections following the T wave. Other ECG changes associated with hypokalemia can include T wave inversion, but U waves are more characteristic. 47. A patient presents with an ECG showing no P wave, a rapid, irregularly irregular rhythm, and a normal QRS complex. What is the likely diagnosis? A. Atrial fibrillation. B. Atrial flutter. C. Sinus tachycardia. D. Ventricular fibrillation. Answer: A. Atrial fibrillation. Rationale: the lack of a distinct P wave, rapid, and irregularly irregular rhythm with a normal QRS complex is characteristic of atrial fibrillation. Atrial flutter usually has a sawtooth pattern of P waves. 48. What does an ST segment elevation in leads 2, 3, and AVF suggest? A. Inferior myocardial infarction. B. Left ventricular hypertrophy. C. Atrial fibrillation. D. Pulmonary embolism. Answer: A. Inferior myocardial infarction. Rationale: ST segment elevation in leads 2, 3, and AVF typically suggests an inferior myocardial infarction. This pattern indicates ischemia or infarction of the inferior wall of the heart. 49. Which of the following ECG findings is typical in ventricular fibrillation? A. Regular, narrow QRS complexes. B. Rapid, irregular QRS complexes. C. Chaotic, disorganized electrical activity. D. Slow, regular rhythms. Answer: C. Chaotic, disorganized electrical activity. Rationale: ventricular fibrillation is characterized by chaotic, disorganized electrical activity with no identifiable QRS complexes, P waves or T waves. It results in a loss of effective ventricular contraction and requires immediate intervention. 50. Which ECG finding is most associated with hyperkalemia? A. Peaked T waves. B. Shortened QT interval. C. Prolonged PR interval. D. Widened QRS complex. Answer: A. Peaked T waves. Rationale: hyperkalemia is most commonly associated with peaked T waves due to the effect of elevated potassium on ventricular repolarization. It does not typically shorten the QT interval, prolong the PR interval, or widen the QRS complex.